Good morning, Mr. Mancini. My name is Sukhman Jassal. I'm a level 2 nursing student at McMaster University. And today I'll be putting in a catheter just because the doctor has put in the orders for number one. And number two, you have complained about having abdominal pain and also the fact that you have difficulty voiding, and you last voided, I think, 8 hours ago. So we'll be putting in a Foley catheter. So before I do anything, I'm just gonna make sure that Mr. Mancini, that you are you by checking your patient identifiers. And I'll also be performing pericare before opening up my catheter kit. To perform pericare, I'll also use gloves, soap, and water, and just making sure that the area is thoroughly cleaned up before we can do any procedures on it. I have my catheter kit, so I'm just going to be opening it really quickly. This will also be doubling as our garbage bag, which I will now place away from the patient, just between their legs, just as far from the sterile field as possible. So I'm just going to be opening this kit really quickly, because I can just only touch the very corners of the kit. So here's my working forceps. This drape is going to be placed in a diamond fashion along Mr. Mancini. So I'm just going to place it. The shiny side goes down. Alright, so I'm just going to put my gloves on before I do anything else within the tray. Just holding it very by the end. And then the next thing I do is take this by the corner, and I'm going to cover the patient up with this. So now that the fenestrator drip is on the patient, I'm just going to take out all this stuff and get everything ready. So I'm just going to do that first. Take this out. Let's take the iodine out for now. And then this is the lubrication that we'll be using for the catheter. And that's the catheter. So I'll test that out after I'm done preparing the solution. So I'll prepare that right now. I'll be emptying this out as that is done. Put this in the garbage, making sure not to touch the garbage bag. And then just gonna mix this a little bit to make sure that all the cotton balls have the solution. We have our 10cc syringe in here, and then we also have the catheter in there. So basically I'm going to take the tip of this off. To test it, we're going to take the catheter, the syringe on this end, as it should snugly fit, and then I'm going to keep the catheter inside the tray, but this part of the catheter, the balloon, should inflate. So the balloon does inflate, which means the catheter is functional. Okay, so I'm just going to deflate it. So we know this is functional. So I'm going to keep this entire preparation in here. And now what I'm going to do is take the lubricant, and we're just going to lubricate the catheter. So Mr. Mancini, what we're going to do right now is just clean the urinary meatus. So if I grab onto the penis with my left hand, I cannot let go, which is my non-dominant hand. The penis is uncircumcised, so in that case I'll have to pull back on the foreskin and then hold the shaft and then clean. But if they are circumcised, then we will not have to pull back. So what I'll do is just clean it with the iodine solution. So my forceps, using circular motion. That's one around my sterile field. Has been cleaned with the iodine solution. I'm just gonna take the remaining cotton and then just move it around my sterile field and put it in the garbage. And then these forceps are now contaminated because they're used to clean the penis, so I'm just also gonna just place them in here. There is another pair of forceps in here, and that I'll be using to move this tray over to this. Just making sure that these little grooves are on this side, because that will help me after. So now I'm just going to explain the procedure to Mr. Mancini. And I should also not feel any obstructions. In the case that I do, we will call the physician. So Mr. Mancini, can you take a deep breath for me? Take another one. I'm just going to insert the catheter. Take another one. You're doing great. So I'm going to insert it 7 to 9 inches. You're doing great. Take another deep breath. Another one. Another one. You're doing great. Ideally you would have to insert the catheter to the point of this bifurcation, but for the specimen it does not go that far. Now that the catheter is inserted, I'm just gonna inject the 10 cc's to inflate the balloon. And now the 10 cc's are in. The balloon should be inflated inside the catheter because we did check it. And now I'm gonna let go with I'm just gonna let go with my non-dominant hand. Hold the catheter from right here. Take the syringe out and leave the syringe on the side, and then I'm gonna connect the catheter bag to this, ensure that the fit is tight. So this seems to be good. I'm just gonna connect the catheter. So we're just gonna pull back a little bit until you feel a little bit of resistance. That means that the catheter has been secured in place. And then once you do feel that, you can tape it to the patient's inner thigh. Make sure you tape the catheter patient's inner thigh. And that the catheter has been taped to the patient's inner thigh, I'm just gonna clean up. So that would just involve me taking this. Take this with me. We didn't use this for the purpose of assessment. So then this will be disposed of in the dirty core. So I'm Mr. Mancini. I've inserted the catheter, as you can tell. And if you feel any pain at any point, hit the call bell. It is placed within reach, so it's on your bed right now. And your abdominal pain now should subside because you will be able to void.
For documentation, I will put 16 French Foley catheter inserted with a balloon inflated with 10 cc's. And then I'll also write that the catheter was attached to the straight catheter bag, and for documentation, I'll also write that the patient tolerated the procedure really relatively well, and that's all for documentation.
Good morning again, Mr. Mancini. I've just noticed that on the doctor's orders that it says to remove your urinary catheter, and that's because you have been voiding quite regularly, and you also said that your abdominal pain has also subsided a little bit. So we're going to be taking your urinary catheter out. So I'm just going to do hand hygiene and then place the washcloth. Place the washcloth when I'll be taking out the catheter, and then after that I will untape the catheter from your inner thigh. That might hurt a bit just because like you have hair there, and then also it's taped. And then I'll take a deep breath and take the catheter out. It might feel a little uncomfortable, but that's completely normal. And then after that I'll give you a bedpan so you can urinate, and then we'll go from there. So Mr. Mancini, before I actually get into the supplies, I'm just gonna make sure that I'm just gonna do the patient identifiers. So I got the supplies required, the washcloth, the waterproof pad, and also the 10 cc syringe. Okay, so before I handle the equipment further, I'm just gonna be putting on gloves. So first the waterproof pad goes down, and then after the washcloth goes down, and then we'll continue with the procedure. So I have disconnected the tape from Mr. Mancini's inner thigh so I can handle the catheter a bit better. Just making sure I don't pull on the catheter because that will be quite painful for him. The washcloth goes between the scrotum and the penis. So Mr. Mancini, now that I've placed the washcloth in the waterproof pad, I'm actually going to be deflating the catheter by using the syringe. And then I'll be pulling the catheter out. You might feel a little bit of discomfort, but it shouldn't be painful. At any point, if you do feel pain, let me know, and then we can call the physician down and see what's going on. So when I tell you to take a deep breath, please take a deep breath. Just deflating the catheter now. 10 cc's have come out. It's going to take this out and put it on the side. And Mr. Mancini, take a deep breath. You might feel a bit of discomfort, but it shouldn't be too painful. So with this hand, I'm going to hold just after the penis. Take a deep breath for me. Awesome, you're doing great. You're doing great. Take another one. You're doing great. You're doing great. Another one. You're doing awesome. Okay, and it's out. I'm just gonna discard all of this, and then I'll come to clean you up really quickly, okay? Mr. Mancini, the procedure seemed pretty okay to me. How did you feel? It felt good? Okay. Now that the catheter is out, you should be urinating within a couple of hours. And then here, I'll place a bedpan on the side. Again, I'll place the call bell on the side of your bed. And if you have any discomfort, if you feel any pain, please call me on the call bell. The first time you do pee, or the first few times you pee, you might feel a little bit of a burning sensation, which is normal. A lot of patients have said that they feel it. But if at any point it is painful to pee, please let me know, then we can see what's going on. Sound okay? Okay. And here is, I'll also provide the pen and the pencil, or pen and the paper, to just make sure that you write down when you're urinating, just so we have a more accurate understanding of like your urinary patterns. Before I leave Mr. Mancini on his own, I'll do pericare. So that is a normal that's a normal sort of guideline to do after you take the catheter out, just to make sure that the urine is clean. Documentation of taking the Foley out. I'll document that the 16 French catheter has been taken out, along with the time that it's been taken out, and then I'll also assess the urine that was in the catheter, and also measure how much it was, assessing being the color of the urine, the odor of the urine if there's any, and so forth. And then also document the fact that the patient took the procedure well, or if they didn't take it well, and if there's any complications or any obstructions along the way.